Today, the Supreme Court made a major move. It is now going to pave the way for states to block funding to Planned Parenthood. So that means patients will not have the right to choose their medical providers. Now, this happened in South Carolina, but what could it mean for folks right here in Massachusetts? Let's go to our Erin Logan. She is in the city for us tonight and has the answers.
Colton, based on the court's ruling, nothing would happen here in Massachusetts. State leaders would have to deny Planned Parenthood the right to seek Medicaid money, and there's no plan to do that. I spoke with the president and CEO here, and she says based on the decision in South Carolina, she understands why there's cause for concern and the timing upsetting. It's been a hectic week for Planned Parenthood advocates here in Massachusetts. Its CEO speaking out.
This isn't just a looming crisis. This is the reality of today.
Just days ago, Dominique Lee and women congressional state leaders recognized the 3-year anniversary since the Supreme Court overturned Roe v. Wade. It threw the matter of abortion back to the states. Right away, a handful of states put strict limits on the procedure.
Abortion banned or restricted in 20 states.
On Thursday, another hit. Supreme Court justices ruling that states could also cut off Medicaid funding for Planned Parenthood.
This is really an attack on providers who are keeping abortion legal and accessible.
The ruling means that in some states, if a woman is on Medicaid and allowed to pick her own health care provider, Planned Parenthood won't be one of her options.
That means cutting essential care from cancer screenings, STI testing, birth control, gender-affirming care.
Lee assures patients they are safe in Massachusetts for now. President Trump's big, beautiful bill calls for ending Medicaid cash for Planned Parenthood federally.
We are not immune, right? If Congress succeeds in cutting federal funding, more than 40% of our patients are on mass health, and so those patients could be impacted.
But earlier this week, fear of Planned Parenthood's future was voiced as congressional leaders discussed what they're calling President Trump's
big, ugly bill. This bill would tear $15 million from Planned Parenthood here in Massachusetts. 96% of Planned Parenthood's clinical work has nothing to do with abortion.
And Planned Parenthood CEO reminds patients that Massachusetts has a long-standing history of protecting reproductive health care and making access to health care a right, not a privilege. We're live in Boston tonight. Erin Logan, NBC 10 Boston.